This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Our program is a 3-year program, so most people, they all have their PGY 1 year and then come over here for PGY 2 through 4 years. Main highlights of the program. So our inpatient blocks are set up where we have 6 of the months of inpatient during PGY 2 year. And then during PGY 3 year and PGY 4 year, we have 3 months each of inpatient rehab. Kind of allows you to get more of into the senior role in that 3rd year and 4th year and kind of oversee the PGY 2s who are doing 6 months of inpatient rehab. Probably one of the unique things about us, so we're a new program, and then our class right now, the PGY 4s will be the first graduating class. So one of the common questions people have is, what's your call schedule like? So we actually just started kind of figuring that out over the last kind of year and a half, as we've gotten a full group of residents, and the bulk of our call is actually in the PGY 3 and PGY 4 years. And it kind of allows the PGY 2s, when they're on the 6 months of inpatient rehab, to kind of start getting used to everything, have the senior guidance, and then the seniors are kind of helping a lot with call and any questions that the interns might have. So that's how our inpatient rehab is scheduled. So with the 6 months, 3 months, and 3 months, you get 12 total months of that. And then for the outpatient, we have 3 blocks spread out for EMG. We have a block, actually 2 blocks, one during your PGY 3 year and one during your PGY 4 year for sports medicine. If any of you guys are familiar with Dr. James Andrews, he is a pretty famous orthopedic surgeon who works with a lot of athletes, and we have the good fortune of doing a rotation over at that institute. So anyone who's interested in sports medicine, we get pretty great training for that. I'm on that rotation right now, and it's really good. So we get a couple blocks of that, and then we also have electives during your PGY 4 year, and I know a lot of the residents have been interested in actually doing additional months over there for sports medicine. And then other blocks that we have, we also have multiple musculoskeletal blocks, which we do with our program director, Dr. Belcher. She's also pain management trained, and we do pain management rotations with her. And then for the PGY 2 class incoming, they actually have added a couple different pain management providers for them to rotate with. So you get a lot of training with interventional spine, musculoskeletal. If anyone has interest in that, and I know that's a big interest area for a lot of incoming PM&R applicants. Other things to note for people interested in like TBI, spinal cord, you get that kind of bread and butter teaching during the inpatient rehab rotations. Other things to kind of trying to, I don't have all of our rotations pulled up at the top of my head. We do have, oh yeah, that's a common one, is the pediatric rotation. So we have a variety of that. We have pediatric orthopedics, pediatric rheumatology, that we do over at a nearby pediatric clinic. That is one thing that here at our facility, we don't have an inpatient pediatric rehab, which is actually common at the smaller community hospitals. Usually you'll have that at the bigger academic centers. But between the pediatric orthopedics and the pediatric rheumatology rotations, we were able to see a lot of classic pediatric cases, such as cerebral palsy and different type of spasticity management for that, and different equipment needs, such as wheelchairs and bracing. Other things to no. Oh yeah, Steve's gonna jump on and talk about electives.
Yeah, so in terms of our electives, we generally have those during our PGY4 year, which is currently where we're at right now. So we essentially have every program might be structured a little differently, but what we're doing right now is we have one elective that 1 month of elective where we can essentially, if we can create a contract with another facility anywhere in the country, you can go ahead and do a rotation with them if you have a specific interest in the area. Whatever subspecialty you want, whichever, whatever is going to essentially prepare you for future applications. Generally, you might actually be looking into that. Might be better if you could find a program that has electives that you can do during PGY3 year, because then it'll prepare you ahead of time before you apply for fellowship, and to essentially see whether or not you want to continue with that subspecialty in the future. So we have that 1 month during our PGY4 year. The only reason why it was so late was because, again, we are a new program, so we're just kind of getting things started to trial that. So our next class would actually benefit from that, and they could have a possibility of shifting that block to a PGY3 year. But otherwise, we also have selectives, which essentially means that it's an elective that's within the area. That's an easy way of explaining it, within the vicinity of whichever hospital systems that you guys are already affiliated with. So essentially doing another month of sports medicine, if you like, or rotating with ortho, or doing a spine elective, those types of things. So those are kind of the highlights of that, but essentially what Dr. Gill was alluding to with regards to jumping up through the years, as you go from PGY2 to PGY4, if you're going to an advanced program, essentially, like any other program, like any other specialty, as you go up, you have more responsibilities and you get pushed into more of a teaching role in order to go ahead and provide guidance to your classes. Any other questions? Anything along related to our program, or anything other information we can provide? No, yeah. Again, I apologize. We weren't able to pull up our presentation. We're still having technical issues because of login issues.
If you guys have a PowerPoint or PDF version of it and want to send it to us, we have like a folder with everyone's presentation. So that other attendees, if they want to access it, if you guys are okay with that.
Absolutely, no, that'd be great. Thanks for that option again.
Yeah, of course. Not the first person to have technical difficulties, so.
Yeah, at some point it was getting to so much time wasted on trying to pull it up that I figured we'd jump on and just start talking.
Yeah, sorry. We're using my laptop and trying to log into Gil's work email, and that's not panning out so well. That's secure logins for you. Yeah.
Looks like you guys have a couple questions in the chat.
Okay, let's go through it. I know you guys have a number of military bases in Pensacola. Oh, that's a really good question. No one's asked that before. Asking about military and if we provide any military care. We actually do not at the moment. I would say where I've seen the most, if I have run into, is we'll definitely run into people who will have musculoskeletal complaints in our outpatient musculoskeletal clinics or the sports medicine clinic, or I've seen some people in the EMG clinic. But as far as dedicated rotation to military, we do not have that set up quite yet. But that's a good question. I'm sure, again, we're a new program and we're kind of growing and branching out. And so something like that, if that like kind of becomes a community need, or, we kind of see that, that could be a good way to further educate the residents. That's always something that can kind of grow.
Let's talk about is call schedule. So
I kind of mentioned some of that. Yeah. Are we able to provide contact info? Absolutely. Yeah, so I'll actually type in my email right now into the chat. And then I'll also provide the PowerPoint, which will have our coordinators' email and information and a variety of other contact info.
You guys have the PM&R Scholars Gmail at gmail.com.
Yes.
Yeah, you can send it to that email and we'll take care of it from there.
So I just sent my email. Yeah, any questions can be forwarded there. I'm trying to remember some of the questions. Oh yeah, can't believe I haven't talked about this. So I know a lot of the questions I had when I was on interviews was just basic, living situation, food at the cafeteria, kind of things outside of the actual rotations. So you can easily live nearby. I think 3 of us live within 5 minutes of the hospital. Another person was living downtown, 15 minutes away. So you can kind of live downtown, but still have a pretty easy commute back to the hospital. And then as far as food goes, actually, so far, we were supposed to have a stipend on food. I think about like $1,500, but so far they've actually let us kind of keep having food, within reasonable limits. So we've been able to have like breakfast, lunch each day when we're on the inpatient service. So those are other couple things that have been nice.
Tons of things to do in the area in terms of, getting out. Now that we have a full class, we've actually been doing a lot of outdoor activities. We actually just recently went to Crab Island, which is about an hour and a half east of where we're at right now, just to kind of essentially hang out with the entire class and just bond. So it's been great coming, growing as a class and kind of all of us getting into our roles and being able to, provide advice and guidance for the future classes. In terms of like other things that we're close to, we're, only two and a half hours away from Louisiana, essentially, or New Orleans. If you want to drive out there, that's an easy way to get to. An hour east of us is Destin. If you go further than that, you can get to Panama City. And going far east, going toward Tampa and everywhere else. A little bit west of us is Perdido Keys. Along the entire Panhandle coast, it's just, nice sand beaches, and it's just a fantastic program because you can always get out and relax and just, de-stress for the weekend. Not that our schedules are too heavy to begin with, because it's nothing compared to, the intern year is going to be a little rough for everybody going into it. That's just how it is. But there's light at the end of the tunnel, and for PM&R anyway, every year does get better. At least for sure, that's been the case for our program. And it's been, the entire time has essentially been fantastic, both education wise, getting a lot of connections with the doctors here because we're a new program. There's a lot of older docs that have already been practicing for so many years, and a lot of our faculty advisors have all been practicing for 15, 20, 30 years, essentially. So, we have a lot of people who are more than willing to provide additional, either relationships, to link up with other programs because they know other people elsewhere, or just additional experience within a specific field or subspecialty. And we're still, building upon that. In terms of what would make someone a good fit for our program, honestly, just what would make you a good fit for any program, essentially, right? Just willing to learn, willing to, after your PGY 1 year, for sure you would have done enough work and gone through enough medicine or surgery to be more than appropriate to continue with your PM&R years. Again, PM&R residency is not particularly difficult. It's just more of a learning curve for getting used to the team-based approach and learning how to turn off your either internal medicine brain or your surgery brain, and to get more into a team-based environment so that you can guide the speech therapist, occupational therapist, physical therapist, the nurses. Essentially, we all work as a team along with the case managers and everyone else to provide the best care possible for your patients. So that's the best way that I can explain it. If you guys have any other further questions, we're more than willing to stay a little longer if you guys don't have to end right away, because again, we apologize for not being able to pull up the PowerPoint, but we can stick around and answer any more questions for as long as you like. But overall, you haven't lost any information in terms of what we've conveyed so far about our program in terms of the schedules, and Dr. Gill has already given information about most of our rotations and the experience that you get. The big numbers, though, when you go through ACGME, essentially requirements and fulfillments, a lot of it is EMG, Botox, a lot of injections, ultrasound guided stuff. And all of those things, we fulfilled all of our numbers within our first year of PM&R training, so our PGY 2 year, except EMG. And essentially, you could complete that within your third year, numbers wise. And we're already there, so we have more than enough experience or exposure to the procedures that you need in order to graduate. But obviously for EMGs and nerve conduction studies, the more you can do, the better for any other procedures as well. Likewise, that you want as much experience as you can get before you become an attending. Observerships outside of the VSLO. So as far as that goes, it would be best to ask our program coordinator about that, and we can provide contact information. We'll forward the presentation to the email. And essentially that'll have the contact information of our new program coordinator so that you can ask those questions to her. I honestly don't know the exact answer to that, but I know that we do get medical students quite often. So if it's a place where you think you'd want to rotate, feel free to email us as well, and we can get you into contact with our program coordinators.
Yeah, I have a little bit of insight on that. The last couple of years, we didn't participate in the VSLO just because we were a new program, but we started getting a few medical students from FSU, which is nearby, for the last couple of years. So I'm sure with time we'll be able to get that expanded. So again, communicating with our program coordinator as that develops would be great.
All right, thank you guys so much. I think
Thanks,
everyone's emails were provided. If any of the attendees have any follow-up questions, just shoot the residents an email. Thank you guys so much for being here. We really appreciate you taking the time. We hope you learned a lot, and we hope to see you at the next session on the 23rd.
All right. Appreciate everyone's time.
Thanks.
Apologize for the technicals, but let's hope to see you guys next year. All right.
Thank you, guys.
Thanks, bye.